This is Dr. Mubin Sayed from drbeen.com. Welcome to one more show. So the summary of the discussion today is the following. There is a study that is done by researchers from Brigham and Woment Hospital, Mount Sinai Hospital, and Cleveland Clinic, and more, in which the researchers demonstrated that individuals, people who are on statins for cardiovascular risk, for cholesterol levels, who are on statin, when they measured their cholesterol levels, high or low, versus their inflammatory levels, high or low, they found that the people with the higher inflammatory biomarkers had much greater risk of cardiovascular events and death compared to those who had higher cholesterols, proving that to reduce the risk of cardiovascular events and cardiovascular death and all-cause death in the people who have had cardiovascular events or are on statin-like drugs, the more important thing to control is inflammation than controlling cholesterol. So this is not a generic message that do not control cholesterol in general. This is for the people who are already on statin. That means they're controlling cholesterol. After that, the most important thing to control is inflammation. So let's go over this study together. It is mind-boggling and an important fact that is right there in front of our eyes to understand where to focus to have health, cardiovascular health. So first, references. This is drbeen.com. Then this is a commentary on the study that I'm going to look at. So this commentary was published 2023 April. Inflammation beats cholesterol. A comment on the unequivocal driver of cardiovascular disease risk. This is the study. It is printed in the Lancet. The inflammation and cholesterol as predictors of cardiovascular events among patients receiving statin therapy, a collaborative analysis of 3 randomized trials. Then you would see that I have a couple of places on drbeen.com. One is in articles. It is free. You do not need to give me your email or money. Here I am keeping track of the inflammatory pathways and their modulators, and I'm writing articles over here that you can read to help you figure out how to modulate your own pathways, of course, with your doctor's approval. And here is the courses page, and this one actually needs your subscription. Here in the chronic inflammation and inflammation area, this course, all the lectures that I'm doing on inflammation, I'm actually going through inflammatory pathways and how to modulate them with herbs, with lifestyle choices, and with allopathic medicines. And I am uploading those videos over here. So this is now all the references that you need. And now let's start with my diagrams. So the reason that I draw this diagram is that in the inflammation, we start focusing on the cells, the cytokines, the interleukins, and blah. What we do not focus on, or sometimes what we ignore, is the actual mechanisms that are running within the cells, the pathways that are running, which need to be modulated to control the inflammation. So this is my mascot to discuss that the engine of inflammation need to be understood. And I believe every one of us should understand these mechanisms. Now the study. 31,245 individuals, participants from 3 different studies. All of these participants were already on statins. They took their blood to look at their residual inflammatory marker. What that means is they looked at their C-reactive protein over time to understand if people were developing more and more inflammatory state, and if so, what was the relationship of that state with the cardiovascular events, that is heart attacks, ischemias, or cardiovascular death, or all-cause death. They also measured the low-density lipoprotein cholesterol levels, LDL-C levels, that we are all so scared of and try to manage, and looked at their association of higher LDL-C levels to cardiovascular events. And they compared people who had higher residual inflammation versus higher residual cholesterol levels. What do you think before I go to the next slide? Do you think that it would be more cholesterol means more events, cardiovascular events, and more cardiovascular risk of death? Or do you think that it will be more inflammation leading to more risk of cardiovascular events and death? And do you think it would be more inflammation will be higher, significantly higher than cholesterol? Or what do you think cholesterol levels, higher cholesterol levels will be significantly higher in terms of risk and death than inflammation? Think about that for a second and I'll go to the next slide where the answer is. So here, I created a quick chart from that data. So they were measuring in both of these groups cardiovascular events, they were measuring cardiovascular mortality, and they were measuring all-cause mortality. Individuals with greater residual cholesterol levels, low density lipoprotein cholesterol levels, the bad one, and how they compared that was highest quartile versus lowest quartile. So higher levels versus lower levels over time. And what they saw was that individuals who were on statin therapy and had higher cholesterol levels, their cardiovascular risk event was neutral. If you see here, adjusted hazard ratio was 1.07, and they adjusted for age, sex, gender, etc. Adjusted hazard ratio 1.07. So you could say that here 7% increase in higher cholesterol levels, but look at the 95% confidence interval, which is 0.98 to 1.17, which crosses unity. That means it is neutral. So this has no bearing. So higher cholesterol level in people who are taking statin, in this study, they did not have any bearing to increase cardiovascular event or reduce cardiovascular events. Okay, how about death? Cardiovascular mortality, death because of some cardiovascular problem, heart attacks, for example, strokes, like that. In those individuals that had higher LDL, they had 1.27% in adjusted hazard ratio. That means 27% increased cardiovascular mortality incidence in people who had higher cholesterol compared to those who had lower cholesterol in those who were taking statins. And the range was 7% to 50%. So 7% increase to 50% increase, p-value is significant as well. So this is correct data, significant data. Similarly, all-cause mortality 16% increase, and the range is 3 to 32%, and the p-value is significant as well. So keep an eye on the following numbers. This one is neutral, then 27% increase in cardiovascular mortality, risk of cardiovascular mortality, and 16% increase in risk of all-cause mortality in people with the higher amounts of LDL-C. Now, check this out. Those that had higher inflammatory state, those who had higher amount of C-reactive protein, which is a biomarker for inflammatory state of the person, and they were observing their state over time. So highest quartile, that means the people with the highest amount of C-reactive protein compared to those who had lower amount of C-reactive protein, that means people with the greater inflammation versus lower inflammation. What was the result there? Cardiovascular events, the heart attacks, for example, adjusted hazard ratio 1.31, 31% increased risk. Now remember, increased low density lipoprotein, increased cholesterol was neutral for cardiovascular events in these patients who are on statin. But increased inflammation in these patients who were on statin was increasing the risk by 31%. And not only that, the range is 20 to 43%. And p-value is significant. Then how about cardiovascular mortality? With the cholesterol increase, the mortality was 27% increased risk of mortality, right? Cardiovascular. Here, look at this. Increased inflammation meant 168% increased risk. 168% versus 27%. And the range, 122 to 223% increased risk of incident cardiovascular mortality. P-value is significant. I hope this registered. Cholesterol level increased only had 27% increased risk of cardiovascular mortality. That means it should be controlled. But inflammation, 168%, and then range 122% to 223% increased risk of incident cardiovascular events, death. Which one would you control if you had choice to do just one? Of course, I would say inflammatory state, but you have a choice to do both. So you would work on both of them. How do we handle the inflammatory state? I would give you some summary of what I did as part of the inflammatory lectures. And the best is that you become a member of Dr. Bean and watch those over there. This is no way of pulling you towards those lectures. Up to you. I'll actually show you the summary results here. Now, all-cause mortality. Higher LDL levels in patients on statin, 16% increased incident risk of all-cause mortality. If inflammation was higher in these individuals, 142% increased incident risk of incident all-cause mortality. And the range, 112% to 177%. Increased risk of incident all-cause mortality. P-value is significant. If a doctor is speaking with you about the risk of cardiovascular events going forward, I would look at 2 studies for them to provide you some data or provide you some clues. This study that shows inflammation is more important. It beats cholesterol for cardiovascular events in patients on statin. And the second, the Harvard Adult Development Study, which showed that patient, or actually even Rosetto study as well. These studies showed, the Harvard study, the Rosetto studies, these studies showed people who have happy lives, happy relationships by midlife, they had healthier and longer lives compared to those who were lonely or had toxic relationships, and they had shorter and lives with more illness and disease. And it was so interesting that smoking, alcohol, obesity, cholesterol, nothing mattered more than happiness. So Harvard's article about that has the title, Genes Are Good, but Joy is Better. So I would take just these 2 studies to understand how do we reduce the risk of our cardiovascular events. And then if you wanted to reduce the risk of cancers as well by 50% for the cancer deaths and 40% for cancer risk, then I did that study a few days ago that lifestyle modifiable choices like smoking, obesity, good food, good dietary habits, etc. are very important to reduce the risk of cancer deaths by 50%. Now, interpretation. Among patients receiving contemporary statins, inflammation assessed by high sensitivity C-reactive protein was a stronger predictor for risk of future cardiovascular events and death than cholesterol assessed by LDL-C. These data have implications for the selection of adjunctive treatments beyond statin therapy and suggest that combined use of aggressive lipid lowering and inflammation inhibiting therapies might be needed to further reduce the atherosclerotic risk. So this now I have very honestly presented to you, transparently presented to you these studies and their interpretations. Now, a bit of my interpretation. Lifestyle, happiness, inflammatory control is much more important than just taking drugs. And so I believe strongly that all of us should know what are the inflammatory pathways and how are they, the major inflammatory pathways, and how to modulate them. So we have, for example, in my Zoom sessions that I'm doing with the supporting Beans and Dr. Bean members, we have talked about TLR pathway, NLRP pathway, nuclear factor kappa B, MAP kinase, JAK-STAT, arachidonic acid, PI3K, and next week we're going to talk about HIF, or hypoxia-induced factors. I think all major pathways should be on your tips and how to manage them. For example, in these discussions, I have discussed this, that for TLR pathway, for example, vitamin D, B12, A, zinc, copper, iron, microbiome are important. And I saw that when I did this discussion last time, there were comments that, hey, how about Boswellia? How about X? How about Y? Absolutely. The point is to control inflammation, whichever way your inflammation is better controlled. Controlling inflammation is better than controlling cholesterol for those who are already on cholesterol management. And I would say all of us need to control our inflammation. As we age, even if we don't have illnesses, our inflammatory state continues to become heightened. We need to learn how to manage it, and we have to have those aspects, those are herbs or lifestyle or supplements or foods, part of our life. NLRP pathway, for example, that's another inflammatory pathway, very important one, potent one. Vitamin D, curcumin, omega-3, resveratrol, Mediterranean diet, exercises. Subclinical inflammation, nuclear factor kappa B, for example, vitamin D, some studies say it does, some says it don't, so yes or no. Curcumin analogs, omega-3s, resveratrol, JAK-STAT pathway, curcumin, resveratrol, quercetin, EGCG, green tea, Boswellia. And then finally, so if you wanted to hear more, please join me on Dr. Bean's side. But here, this is the commentary. Inflammation beats cholesterol. In this commentary, there was just one statement that I thought was very important. And I would read that for you, but generally, please make sure you are aware of your C-reactive protein levels, you are aware of your tumor necrosis factor levels, and you are aware of your interleukin 1 and 6 levels. That would tell you your inflammatory state. That has to be combined with cholesterol. Cholesterol on its own is an older technique to understand the risk of cardiovascular events and cardiovascular deaths. So here, the importance of monitoring inflammation in patients on statin therapy. While statins are effective at reducing cholesterol levels and lowering cardiovascular risk, it is important to monitor inflammation markers in patients receiving statin therapy. Elevated levels of high sensitivity C-reactive protein, interleukin 6, may indicate that a patient is at increased risk of cardiovascular events, and if his cholesterol levels are well controlled, even if his cholesterol levels are well controlled. In these cases, additional therapies such as anti-inflammatory medications may be necessary to further reduce cardiovascular risk. I would continue to say this. We have to learn how to handle our inflammation by lifestyle, by foods, supplements, and then, of course, other medicines as well. We have to learn this. This is our health and our longevity. Longevity with health is more important than just longevity. So this is the discussion. Thank you very much for tuning in. There are some links in the description of this video for these study references. Plus, if you would like these kind of talks, you can support this work. And there is $4.99 worth of a link in this description of this video that gives you access to Dr. Bean, plus provide support for this work as well. There are other links as well. You can buy me a coffee. You can use PayPal. You can become a member of Patreon. I would love it. We do 2 weekly live Zoom talks with patrons. and the Substack members and the YouTube members, paying members. And we go over these pathways and these topics, and it is an uncensored, unrecorded discussion so that we can just speak our mind and go from there. So with this, thank you very much, and I would speak with you next week. Bye for now. Please do me a favor, like, subscribe, and share. I think this is a study that needs to be shared. And if you don't want to share this video, then take the link from the description for the study and share that link. But share it, please. It is good for you. It is good for your loved one and friends. Thank you. Bye for now.